All right. Well, I think we're good to begin. I'd like to welcome everybody to our ECHO session today on creating culturally safer palliative care education for Indigenous communities. I will briefly go over a territorial honoring today. So before we get into it, I would like to take the opportunity to acknowledge that the land on which I am presenting from, the city of Gatineau, is the traditional unceded territory of the Algonquin Anishinaabe people. I acknowledge the historical oppression of lands, cultures, and the original peoples in what we now know as Canada, and we are grateful to have the opportunity to be present in this territory. So if we can go to the next slide, please. And the following one. I will briefly, thank you so much. I will briefly go over the Palliative Care ECHO project. So it is a 5-year national initiative that cultivates communities of practice and helps to establish continuous professional development among healthcare providers across Canada. I invite you all to visit our website, www.echopalliative.com. We will be sending a little link in the chat as well. The Palliative ECHO project is supported by a financial contribution from Health Canada. The views expressed herein do not necessarily represent the views of Health Canada. So next slide, please. Briefly, you might know Pallium Canada for a lot of our LEAP programs. Essentially, our LEAP core is one of our most popular courses. It is an interprofessional course, focuses on the essential competencies to provide palliative care approach. It is accredited through the CFPC and the Royal College. Once again, I invite you to check out the Pallium website to learn further about this course. Next slide, please. So I'll introduce myself. My name is Diana Vince. I'm the Palliative Care ECHO Project Manager at Pallium Canada. I've been with the organization 6 years, and I will hand it over to our presenters to introduce themselves. Holly, if you'd like to start.
Me, Gwetch, Diana. So bojo, we jwe queen edition cost. Then I've been in Donjiba Makwado Dam. My English name is Holly Prince, and I am an Anishinaabe Kwe from Opawaganisining here in Northwestern Ontario. I come from the Makwado Dam, the Bear Clan, who are the medicine people in Anishinaabe communities. I'm a social worker by background, currently doing my PhD in educational studies here at Lakehead University, focusing on decolonial education and the resurgence of Indigenous knowledge as people prepare to journey back to the spirit world. I'm the lead for the Indigenous Peoples Health and Aging Division here at the Center for Education and Research on Aging and Health at Lakehead University, where I work as a project manager. And part of my role is to plan, implement, and evaluate palliative care education and health equity initiatives for Indigenous peoples across Canada. So Miigwech, Jessica?
Hi, everyone. My name is Jessica Wyatt, and I'm a white settler originally from Treaty 9 territory, the Timmins, Ontario area, but I have lived in Thunder Bay for the last 20 years. I'm a knowledge broker here at the university, and my main role is to coordinate palliative care education for Indigenous communities across the country. My background is in English and women's studies and education and project management.
Thanks, Jessica. Good afternoon. My name is Cassandra. I'm a curriculum developer here at SARA. I'm also, like Jessica, a white settler, but coming from Portuguese descent. My background is in public health, but I'm also a PhD student right now studying older adult occupation.
Thank you so much to all three of you. So we can go to the next slide. I will briefly go over the conflicts of interest. So like I mentioned, perhaps before, Pallium Canada is a non-for-profit organization partially funded by Health Canada. And we also do generate, in order to support operations and research and development, from course registration fees and the sale of our pocketbook. So I myself do not have anything to declare. And as for whatever our three presenters have to declare, you can see it on the present slide. So we can go next. Simply some brief reminders. We'd like to. I do see the chat is already. You know, a lot of people are introducing themselves, so that's fantastic. That's what I was going to say. Please feel free to introduce yourselves in the chat. Say where you're from and what is your profession. We would like to encourage you that if you do have any questions, please, instead of using the chat function, include them into the Q&A function. It's simply a different box, and it allows us to address the questions at the very end of the presentation in a little more organized fashion. The session is being recorded, and the recording and the slide deck will be emailed to registrants within the next week. So I will now pass it along to Holly.
Miigwech, Diana. So can you forward the slide, please, Cassandra? Thank you. So before we begin, I want to begin by paying my respects to the elders past, present, and future, for they hold the knowledge, teachings, traditions, and future hopes of my people. I want to acknowledge the land that we currently own here in Thunder Bay as home to the Anishinaabeg peoples, the territory of Fort William First Nation, who are signatories to the Robson Superior Treaty of 1850. And while we meet on this virtual platform, I want to acknowledge that this education and the work that we're going to be doing over the next hour or so is going to be crossing many lands, nations, communities, and territories. And land acknowledgements are important to really acknowledge the land to which we each call home. And it really is about recognizing the ancestral and continuing relationships that exist between Indigenous peoples and their traditional lands and territories. And most importantly, land acknowledgements recognize the land as a living being, and in honoring the land, we are reaffirming our commitment to Mother Earth. So through our work today here and the work that we do at SARA, we have learned that education for healthcare providers, family members, and community members is really key in building and sustaining a successful program that supports people as they prepare to journey back to spirit world. So what we're going to do today is share some of those innovative resources and tools that we have developed here at Center that really supports this process and acknowledges a way that we can share these resources with people on the call. So next slide, Cassandra. So throughout our objectives for today is really to look at that process that was undertaken by our education team here at our center. We call it SARA. It's the short form for the Center for Education and Research on Aging and Health, on developing culturally safer palliative care education for health and social care providers who are living and working in Indigenous communities. And we're also going to showcase some of these new tools and resources, and also highlight some of the ways that you can access some of these tools and resources to actually complement and integrate them into your practice. So we're going to start off with just a Menti question. So what I'm going to ask you to do is to take your cameras, if you have your cameras from your cell phones with you, and to take a picture of that little box QR code in the bottom, as well as I'm going to ask Jessica or Cassandra to put the link in the chat box. So you can go to www.menti.com, and then you would implement this code 45854643. So when you're thinking about, delivering education to Indigenous learners and Indigenous communities, what are some of those important or key considerations that come to mind when you're thinking about delivering education? So maybe some of those unique challenges, things that you need to take into consideration when you're targeting Indigenous learners. So again, you can use your QR code to go to menti.com and put some of these kind of key considerations in. And as you guys put them in, they're going to start popping up on our screen, and we'll start populating some of these answers. So as you can see, it's about being culturally sensitive and literate. Trauma-informed care within education is absolutely something that we look forward to with that. So around language choices and cultural differences, really acknowledging what the individual already knows. So absolutely focusing on their capacity, focusing on their strengths within community, creating that awareness, having culturally appropriate context and references. And again, we're going to talk a little bit more about this a little later on. So really looking at some of those cultural beliefs about death and dying, and really looking at, where that learner is coming from. So all of these things we're going to be talking about in different ways throughout our presentation today to really look at how do we actually create education, support education, and deliver education that is more culturally safer for Indigenous communities. So the next slide, Cassandra. So when we think about the work that we do at the center, what we really ground our education experiences in is within cultural safety. And so according to the First Nations Health Authority, when we think of cultural safety, it's really that outcome that's based on that respectful engagement. And it really recognizes and strives to achieve and look at those power imbalances that are inherent within our healthcare system and within our educational system as well. So what it does, it seeks to achieve better care through being aware of differences, decolonizing our perspectives, looking at power relationships. As care providers or as educators, it's about implementing reflective practice. And really by allowing the individual, the patient, the learner to determine, what that encounter looks like and whether it's safe or not. And when we think about cultural safety only occurs when Indigenous peoples tell you that they feel safe. So it's not up to the Indigenous person or family or learner to advocate or to teach or to direct the organization. That's really, our responsibility as healthcare providers, as educators, to be able to engage in discussions with Indigenous communities, to really look at ways that we can support them. I often say culturally safer education or culturally safer care, because I was directed by an elder from the Manitoba territory who really talked about, the fact that our healthcare system and as a result, our education system as well, was never designed or reflected of Indigenous people's values and beliefs. So all we can ask for is for that education or for that care to be culturally safer. Next slide, Cassandra. So what we're going to do today is really focus on how to build and support capacity within Indigenous communities to provide care to people who are preparing to journey back to the spirit world through education. And we're going to share some of our educational initiatives developed at our center and talk about some of those keys to success. And these educational initiatives are targeted at all levels within the community care team, including education for registered and clinical staff, education targeted towards frontline health and social care providers in the community, as well as education for the community and family caregivers. So all of these initiatives are really designed as a step in the larger process of the development of comprehensive palliative care services in Indigenous communities. So I'm going to hand this over to Jessica, and she's going to take us through a couple of the different curriculum and the resources that we've developed here at our center.
Thanks, Holly. I think we'll start with the video. Cassandra, next slide.
In response to the need for culturally relevant palliative care education, the Center for Education and Research on Aging and Health at Lakehead University developed the Palliative Care for Frontline Workers in Indigenous Communities curriculum. This workshop is delivered in person over 2 days by a team of facilitators that includes elders, knowledge carriers, and spiritual guides. The workshop is an introductory level that explores the physical, mental, and emotional and spiritual aspects of the palliative approach to care in an Indigenous context. The workshop utilizes culturally relevant tools and resources to enhance the learning that were developed in partnership with Indigenous communities.
Well, I think it's very important because for so many years, when you learned about palliative care and training, it was usually approached from a Western biomed model that didn't specifically consider the cultural norms and things that were important and relevant to our aging population and people, what they want. What I really liked is the way we brought it down to a very practical community level of conversation, because too often our people are talked to and told about terminal illness and palliative care that will be available to them, but with so much clinical jargon and terminology they may not understand.
This workshop is one step in a larger process of developing comprehensive palliative care services in Indigenous communities.
Participating in this training really helped Mamawesing North Shore Community Health Services enhance their services to the community by adding palliative care. The palliative care program that we developed is called Craters Care. We would not be able to develop this program if we didn't have this training. It really helped us to understand what the community needs are.
Thank you, Cassandra. So since 2018, we've delivered this education in 7 provinces, including Newfoundland, Prince Edward Island, Nova Scotia, New Brunswick, Ontario, Manitoba, and British Columbia. And several years ago, we also traveled to Fort Smith in the Northwest Territories. We've connected with over 250 First Nation communities and over 140 associated health organizations. We have educated over 1,500 frontline care providers from a variety of professions, spanning all levels and areas, from directors of health, nurse practitioners, licensed practical nurses, healthcare aides, spiritual care, all the way to water treatment facility workers and medical van drivers. And as you heard in the previous video, in 2009, in response to the need for culturally relevant palliative care education, Sarah developed this curriculum in collaboration with Indigenous communities, knowledge carriers and elders, and healthcare providers. And the purpose is really to provide an introduction to palliative care to Indigenous people who provide care to individuals with life-limiting illnesses. The curriculum is made up of 8 modules, and they're delivered, as mentioned in the video, either in person in a 15-hour workshop, typically over 2 days, or online in a 12-hour workshop hosted over Zoom, which is typically delivered in 4 3-hour weekly sessions. Some of the highlights for the modules include, in the module on understanding the palliative approach to care, participants are introduced to the Indigenous Wellness Framework and how it connects to palliative care. And in advanced care planning, we talk about specific provincial legislation, along with introducing participants to the Coming Full Circle booklet, which is developed by Canadian Virtual Hospice, as well as other local and regional resources as they are available. In working with individuals and families, participants work through some of those difficult conversations that are had with people who are dying and their loved ones. Pain and other symptoms, we recognize that pain is impacting all aspects of the person, including mental, physical, emotional, and spiritual, and it's treated in a variety of different ways. In Last Days and Hours of an Expected Death, we talk about what does death look like? And what should you do? And we share the Edith Protocol, which is a resource developed for expected death in the home. And we review what medical assistance in dying is, and we provide resources around nutrition and hydration at end of life. In our grief and loss module, we introduce various types of grief and how to support people who are grieving. In our second last module, Helping Relationships and Self-Care, we discuss stress and burnout for healthcare providers. And in community care teams, we talk about the various components of a team and what they might look like in community. And we share a resource developed by the Winnipeg Regional Health Authority on discharge planning. While the content for each presentation in this workshop is different, the design of the modules are similar in that they each include a narrative case story of Dorothy, who is an Indigenous woman who's been diagnosed with advanced stage cancer. There is a connection to the Indigenous Wellness Framework throughout all of the modules. Each module has a PowerPoint presentation, as well as time for small and large group discussions and activities. There are short video clips or vignettes. The entire workshop is supported by an elder or knowledge carrier who will provide teachings along with circles and ceremonies that are relevant to the community members in attendance. And it's always facilitated by the elder. And in addition to the above, we also have a variety of resources and specific references to our companion manual called Preparing for the Journey, which we'll talk about in a minute. And we also provide time for evaluation for each of the educations provided. Support is also provided to the participants, as I mentioned, by an elder. We always have a dedicated quiet room for one-on-one support this way with either the elder or a member of the education team. And when we are connecting virtually, we use the chat function in Zoom. For the in-person workshop, there's also additional activities, including a poster activity that helps participants to explore other ways of communicating what they are learning, and another way to share this information when they return to their home positions or their home communities if they've traveled in for the training. As part of the Frontline Workers curriculum, we've developed, as I mentioned, the Preparing for the Journey, Caring for Indigenous People Who Are Seriously Ill Bedside Resource Manual. This resource manual is an original document for our team at SARA, and it's based on clinical best practices and is designed to provide practical tools and resources for care. It gives healthcare providers, family and community members practical guidance and support. And all the participants who attend our workshop receive this in hard copy, as well as a link to our electronic version. And as you can see on the slide, it's available for free download from the SARA website. This slide has a few examples of the resources that are contained in that manual. Sorry, Cass, you're just on mute.
So, through this work that Jessica's been talking about, and this work with Indigenous communities, we identified a need for additional resources and support for family members and communities caring for loved ones at end of life. And so through that work, we developed an online resource, Walking Alongside Indigenous Peoples Who Are Seriously Ill. And it is based on clinical best practices and the resource manual that Jessica was referring to, the Preparing for the Journey document. So this Walking Alongside document is also available online. Its main focus is on meeting the holistic needs of individuals and caregivers at the bedside. It includes various types of resources that, although it's encouraged to take the the palliative care for frontline workers in Indigenous communities workshop to kind of orient someone to this type of work. Anyone can use it with any kind of some kind of understanding of palliative care. In this next slide, I'll show you some of the documents that were developed. So within each module, there are 9 modules in this document, in this resource, and they have been developed and organized depending on the different parts of the Indigenous Wellness Framework that they refer to. There are slide decks with speakers notes. There are handouts. There are videos, and there are brochures and other resources that are also incorporated throughout. So some of them have been developed through our center specifically and through different resources that we've developed ourselves, but also ones that we've acquired and collected from our community partners. So this is how to access the documents. All of the either information about the workshop or the actual Preparing for the Journey resource manual is also found on our website, sarah.lakeheadu.ca. But the entirety of the Walking Alongside curriculum, which it is intended for community members to view, is all available online. So this quick video will kind of guide us through accessing the full document as a PDF, or also the individual pieces and just viewing it online if downloading it isn't what you're looking for. So on this page, you can actually access, like I said, the entire PDF. And so this will contain all of the resources and links to them that are featured on this web page, including this table of contents, as you'll see. You can find each section of the document is clickable, so it'll take you right to the spot in the document where the information is. Or you can also see that you can open up just the slides if that's something that you're looking for. They're available in PDF, so you can in most PDF viewers, you can open them. And then there's also speaker's notes that go along with that. There are also videos. So some of them are from some that we've acquired from our community partners and some that we've actually developed here at SARA. There's also handouts that we've developed. And like I said, different kinds of brochures, pamphlets, informational pieces that either we've developed or others have. You can go through all of the different modules, the different sections throughout, and you can access them either within the one document or click on the ones that you're quickly looking to access.
So thanks for that, Cassandra. Yeah, some of the slides did become blurry, but if you go to sarah.lakeheadu.ca and you look under the resources, there's a whole complete resource section under the Indigenous Peoples Health and Aging Division. And these are resources that we have curated over the years from a number of different organizational partners. And on that website, you will find all of our resources that we've developed at SARA, including information about the Frontline Workers course, the Preparing for the Journey Educational Bedside Resource Manual, as well as Walking Alongside, which again is an online curriculum for community caregivers. The curriculum Walking Alongside is available for free. Everything on that site is available for free to support community caregivers. And when we were looking at designing the Walking Alongside curriculum, we were really trying to think about all the different levels of community caregivers that required education. So as Cassandra said, some of the resources are around PowerPoints and PowerPoint slide decks, and perhaps community caregivers might use those slide decks to teach other healthcare providers about palliative care. They might use those slide decks to do community-based education, maybe at health fairs. We also try to think of healthcare providers who needed information to train family and community caregivers who are caring at the bedside. So there's some really great resources and videos on how to move people, how to help people, how to support people. There's some pamphlets that they could be, printing off and providing to family and community caregivers. So there's a lot of different resources that we were trying to imagine all the different levels of community caregiving that needed that support. So again, you can go take a look at Walking Alongside. All the resources are there in a number of different formats. We've included things around PowerPoints, PDFs. Again, there's some video documents, some brochures, some fact sheets. And again, through our partnerships with places like St. Elizabeth Healthcare, as well as a Canadian Virtual Hospice, all of their resources are attached within our document and are available on our website as well. And we have some new exciting resources that will be added. So the Walking Alongside curriculum is really considered to be a living document. So as we go along in our journey supporting caregivers in community, we will be identifying additional resources that we could be adding to the Walking Alongside. So again, it'll be a living document, and that website will be a living document so that people can go to and access what they need. So when we were thinking about some of these keys to success, and we were thinking about the work that we do at our center and how we work in collaboration with Indigenous communities to develop this education, I think one of our main keys to success is that this is a project that is Indigenous-led, designed, and implemented. And when we're thinking about that process, I myself as an Anishinaabe am the manager of this process, and working with local elders and knowledge carriers, as well as Indigenous advisory committees on everything that we do to kind of develop our curriculum, to develop our processes, to develop our resources, so that they actually make sense to the people that need it and that they can actually get into the hands of the people that require it. All of the things that we do is guided by elders and knowledge carriers. And as Jessica said, within their educational delivery, they are considered to be active facilitators. So they are a member of our team. So we work with the local communities requesting education to really look at how can we target and how can we work with local people to ground that education. Again, we're coming from the education from palliative care, which is a westernized philosophy, but we want to ensure that to make it culturally safer, how can we ground that education in that local community context and experience? So there's a lot of community engagement that happens in the work that we do. Whenever we get asked to deliver a workshop to an area, a territory, a tribal council, community, we have a whole community engagement session. And that community engagement session is really to identify some of those resources within the community, to really situate, that training in the larger context with the goal of enhancing capacity for that community, providing the communities with the opportunity to discuss their values and beliefs related to caregiving, death and dying, as well as practices, to really talk about that role of that elder and how that elder can support the process, and as well as to ensure that there's a plan for the experiences around grief within the communities as well. It really responds to the actual community needs based on the here and now, meaning that all the education that we deliver in community is really tailored and targeted towards that community. So I would say that we've never really developed or delivered our workshops the same way twice. We're really trying to meet the needs of the community. And in order to be a facilitator working on our team, you have to be very flexible and responsive, and sometimes fly by the seat of your pants, because we're really making sure that what we're delivering is meeting the community's needs. And if things come up in these workshops, we change and we pivot and we make sure that whatever we're delivering is culturally appropriate for that community. When we're looking at developing all of our resources, so although we're coming from it from a westernized perspective of palliative care, we're really ensuring that the curriculum is culturally appropriate and recognizes and respects the cultural diversity of what Indigenous communities are, really recognizing the diversity within and amongst Indigenous communities in relation to their knowledge and teachings regarding death and dying. So as a result, a lot of our content and a lot of the curriculum and a lot of the resources that we developed are grounded within the Indigenous Wellness Framework. And the Indigenous Wellness Framework really focuses on that health and balance. And it was something that we then combined with the holistic focus of palliative care. And the Indigenous Wellness Framework was actually developed as part of the Honoring Our Strengths Culture as Intervention in Addictions Treatment Project. And it really looks at describing how the 4 aspects of self, so the spiritual, mental, emotional, and physical part of being really needs to be in balance in order to achieve health and wellness. And so when we think about that, we recognize that that Indigenous Wellness Framework also has a lot of similarities and synergies to palliative care. And it recognizes that that relationship needs to occur between individuals and families and communities. And so all those 4 aspects are really interrelated and dependent on one another. So some of our other keys to success in our process and what we do is to really ensure that we're really developing culturally relevant and community specific content. And so when we're looking at these, the way we develop that process, the way we develop that content is really providing them with all the information, providing them with all of the PowerPoints, providing them with all of the resources that we have. And it's really about that mentorship process embedded. So when we go to communities and we deliver education, we're always coming in with teams of 4. So there's nurses and social workers, as well as elders who are really working around mentorship, really supporting communities, really supporting where they're at, and providing them with a lot of ongoing support, even following the workshop. We also talk about that ongoing evaluation of content. So whenever we're delivering workshops, we evaluate either at the end of that session or at the end of that day to really figure out, are we meeting the needs of the community? Is there things that are coming up in the workshops that we need to alter, that we need to change? So we do post-delivery team debrief sessions, and those debriefing sessions are really important because it helps us to shape our process and our protocols. We also do quarterly curriculum reviews on all of the tools and resources that we develop. And so we bring together our facilitators to really review that content, to really review that process and figure out what needs to be updated, adapted in order to better meet the needs of communities. We also have an extensive participant review. So we have written evaluations after every module. We evaluate our posters, we evaluate our processes to really recognize that that ongoing evaluation is inherent in the work that we do. So when we're thinking about that evaluation, one of the things that we have heard quite clearly is that the education is, from the community's perspective, very culturally relevant and appropriate. And participants really noted the importance and appreciation of the education that aligned with their own cultural beliefs, values, and traditions. And part of what we do in the education is really recognizing that because we're coming from a westernized perspective of palliative care, what we're really trying to do is to give healthcare providers the language that they need in order to advocate for their clients within that westernized healthcare system, so that they're better able to make those transitions from hospital home, that they're better able to support community members to stay at home as long as they can, but really to be there around that whole process around transitioning between these systems of care. So we have a very extensive evaluation process, and I think that's part of the success of what we do. And we also make sure that all these resources are available. So we do a lot of promotion around our resources to ensure that it's meeting the needs of the communities and that is getting into the hands of the people that need it. So one of the last things I want to focus on is just really recognizing that the education that we deliver here at our center, again, is based on a long-standing relationship and process that we have with Indigenous communities that have worked with us to design, to develop not only our content, but our process, and that ongoing relationship that we work to establish really hard with communities to make our education culturally safer. So again, I want to encourage you guys to take a look at our website, to look at all the resources. There's so many things that even non-Indigenous healthcare providers who are working within hospital systems, who are working within clinics, can use these resources. And again, because we partner with a lot of organizations like the Canadian Virtual Hospice, like St. Elizabeth Healthcare, we're really all trying to work really hard, integrating the work that we do so that it does get into the hands of the people that need it. So as Jessica had mentioned, we use Coming Full Circle, and Coming Full Circle was a document developed within the Canadian Virtual Hospice's livingmyculture.ca project. It's a culturally appropriate advanced care planning tool that was developed by an elders and knowledge circle right from across Canada. And with permission from the Canadian Virtual Hospice, we use those resources within our curriculums, within our walking alongside curriculum for caregivers, and we promote those. And similar to St. Elizabeth, who has a number of wonderful videos around caregiving and that process of caregiving, again, with their permission, we have actually been able to post those things on our website, as well as connect to St. Elizabeth to really ensure that these resources are getting out there for the people that need it. So there's so many resources out there on our websites, on the caregiver website, that if you're looking for resources to support Indigenous clients, Indigenous patients that are coming to access your care, there's going to be something out there that's going to meet your needs as well. So I'm going to ask Cassandra to put us to the last Menti question so that we have enough opportunity for some questions. So again, I just want to think about some of the things that we showed you, some of the resources. And again, it was a very high level of resources, and we're really hoping that you go to their website to really dig into some of these resources and see what's going to meet your needs. But what are some of your biggest takeaways from the session? And again, we're going to ask you to click on that little QR code, or you can go to menti.com and use that code. And just again, think about some of those resources, some of those takeaways, and really looking at, maybe how can you implement some of these resources in the work that you do. So really talking about the community caregiver curriculum. Anything else? caregiver support. Absolutely. So one of the things that, as you guys are populating the chat, I'll tell you a little bit more about the caregiver curriculum. Primarily, we are funded through external contracts and grants. So we have contracts and grants with different communities, organizations, tribal councils, different levels of government to be able to deliver this education, either on a community specific or as or in a provincial specific way. And one of the things that we have found in the education that we deliver is the fact that caregiver education is really lacking for Indigenous peoples. And culturally appropriate caregiver education. And so recognizing that caregivers in Indigenous communities are not just family members, they are community members as well. And many of the healthcare providers who work in these communities are the sons, daughters, nieces, and nephews of the people that they provide care for. So it's a really unique situation that we're seeing. So really recognizing, how do we meet the needs of all community members, whether they are healthcare providers or their neighbor, to really figure out how to meet those needs. So with that, I want to say miigwech to everyone who has come. I see in the questions, we have a number of different questions. So I'm just going to turn towards the questions and really kind of see if we can find ways that we can answer them and possibly provide you guys with some more links of things. So my question is, how is this incorporated into the very medical healthcare system experience? We have also often found challenges with best practice knowledge and actual ability to implement in the broader system. So one of the things that I would say in terms of how we kind of look at implementing this within the broader system is the fact that, the requests are coming from community. And we really recognize that from community, how is it that we can coordinate and ensure that the education is meeting the needs. So one of the things we hear very clearly in communities is that they have their own process of caregiving, and where sometimes they find challenges is around when they interact with that westernized healthcare system. And some of those things say around advanced care planning or consent and capacity, things like that. And a lot of the communities that we work with don't have a lot of formal healthcare providers within communities as well. So it's really recognizing that we're trying to tailor this education to meet them where they are at. We're also trying to look at the transitions between the healthcare systems and really trying to figure out ways to support them. So some of the other things that we do around that is not only provide caregiver education, but really looking at how do we support non-Indigenous healthcare providers who are working in community as well. And how can we look at tailoring some of the education that we develop towards them as well. And I do think that, when we incorporate education within that medical healthcare system, I think it is a two-way street, I would say. So some of it is about educating Indigenous healthcare providers on the westernized healthcare system, but sometimes it's also taking that other approach in terms of educating that healthcare system on Indigenous ways of knowing and the ways that we would provide care in our communities. I'm just looking at the next question is, how do you support isolated communities dealing with palliative patients and needs and access to medical and social spiritual support is minimal? Absolutely. So again, with our education, we're trying to look at all those healthcare providers, all those community caregivers who are working in community and really figuring out what type of education that they need and how can we partner and how can we leverage our resources to better support those communities. So we work with a lot of isolated, remote flying communities in the delivery of education. And I can tell you there's a lot of challenges even with providing education because sometimes they don't have access to the internet. So we take it for granted that when we can deliver online education, it's going to work for everybody. And sometimes it doesn't work for everybody because a lot of the education can't be accessed by remote communities. So what we've done in a lot of the education, especially around the caregivers curriculum, is we have limited copies, but we have actually been able to download those entire curriculums onto USBs to support those communities that have issues around internet. I think one of the other things that we're trying to do is really target communities in terms of their educational needs around what is their needs when they come out of community and what are the needs for them for education when they go back to community. So I would say there's a lot of communities in Northern Ontario, a lot of communities in Northern Canada that are really doing really amazing, innovative work when it comes to supporting community caregivers, when it comes to supporting people within their community. But it is a challenge. One of the huge barriers that we have in Indigenous communities is the jurisdictional challenges when it comes to providing care, when it comes to funding healthcare providers, and that limited number of healthcare providers that we have working in Indigenous communities. So again, take a look at that, and hopefully some of those resources can meet the needs. And again, we encourage you to take some of these resources and embed them within your organizations, within your systems. For instance, there's a whole series of brochures that are available that talks about things like what is palliative care, what can expect, how to support community caregivers. And again, these were developed throughout the Improving End-of-Life Care in First Nations Communities project that we had based here at Lakehead University. And those are resources that you can print off and keep within your, for instance, your health clinics or your hospitals. We have a lot of posters and informational sheets that you could be handing out to clients. Again, it doesn't go into a lot of the clinical care aspects of some of them, but some of them do, again, through our partnerships with St. Elizabeth as well. And I absolutely agree with you, Brenda, when you're talking about educational budgets are so tight. We recognize that. So that is why, in terms of especially the caregivers curriculum, the walking alongside, there's a lot of the resources, all of the resources there are available for free for people to download, to print off as many copies as they would like. And it's something that they can use within communities as well. I think one of the last questions out there was a list of community organizations who have taken this training. We do actually have a list of the communities, but we are not able to share that because it actually is collected by the different tribal councils or the communities themselves. But again, if you're looking to partner with some Indigenous communities, we can absolutely help you to do that as well. If you're looking at delivering some education in your area, take a look at our resources. That they can, support communities and support healthcare providers as well. Now, I just want to check, did I cover all the questions, or is there anything in the chat that I missed? And I see we have Heather McDonald, and I think Heather McDonald is one of our Heather McDonalds from Halifax, Nova Scotia. And Heather McDonald is one of our facilitators who works out in Atlantic Canada, who will be helping us with facilitating some of this education out in Halifax. So nice to see you, Heather. So is there any other questions? So if not, all of our contact information is on here as well, and you can take a look at our Sarah's website, our center's website. All the resources are there. Take a look at them. If there's resources that you've come across that you think might be beneficial to add to our Walking Alongside Community Caregiver curriculum, please let us know. We're always looking to partner with new organizations to include some of their new resources on our website. We're going to be doing the Walking Alongside Community Caregivers curriculum has been up for almost a year now. So we launched it in June 2022. So it's been almost a year. We've actually done another review of it just recently in December. So we will be adding additional tools and resources to the Community Caregivers curriculum, including some new videos, as well as some new fact sheets and pamphlets for community caregivers. Through a couple of new partnerships that we have with organizations as well. So that's about it. If nobody has any questions, I would like to say Bama P and Miigwech to Jessica and Cassandra, as well as to Diana and the group over at Palliative Canada for inviting us to come to share some of these resources. If you want to reach out to us individually, you're more than welcome to do so. If not, I really encourage you to take a look at our website, www.sarah.lakeheadu.ca. Come to the resource section of the Indigenous Peoples Health and Aging Division, and where you will see all the tools and resources that we talked about today.
Thank you so much, Holly, and thank you so much, Jessica and Cassandra as well for joining us today. And everybody who attended the session. We have left a link, feedback survey in the chat. So if you would kindly fill that out, we'd greatly appreciate it. And thank you for attending today. Have a wonderful rest of the afternoon.
Miigwech, everyone. Bamapi.